Small group teaching, which may be better termed as facilitation, refers to teaching sessions with typically 8 to 12 students present. Small group teaching environments offer the teacher a chance to provide more personalised teaching and promote higher levels of cognition from the students. Small group teaching is a very broad term which covers a variety of educational settings, from the typical seminar to teaching in a clinical setting. Therefore, this type of teaching requires a more nuanced approach, adapting to the variety of factors that influence the teaching session. Pause the video and think about what factors may influence a small group teaching session. There are many factors that influence a small group teaching session, but here are some key ones to think about. The students. Do the students know each other, or are they relative strangers to each other? Perhaps a dreaded icebreaker might be useful in this setting. What is their existing knowledge about the subject? What are the cultural and social differences within the group that may influence the knowledge base of individuals, or the interactions between group members? Perhaps an anonymous quiz to get a baseline of knowledge may give you an idea of the diversity in knowledge within the group, whilst not embarrassing individuals. Secondly, think about the environment. Is the learning environment optimal for teaching the subject? A seminar room would be alright for teaching clinical examination, but perhaps would be better taught in a clinical setting. How have you arranged your tables and chairs? Are they all facing each other to promote conversation within the group, or are they all facing the whiteboard? What time of day is it? Is it at the end of a long day when concentration may be reduced? Think about strategies to mitigate this influencing factor. Thirdly, think about you, the teacher. How comfortable are you with the subject matter? Perhaps revising your knowledge or bringing resources to aid the session may be helpful in this regard. What frame of mind are you in? Have you had a long day yourself? Being mindful of this to minimise the influence it has on your session will improve its overall quality. And fourth, the subject matter. How difficult or interesting is the content? Are there engaging methods of teaching a more complex or less interesting subject? Could the subject matter be a motive for the students or yourself? For example, the subjects of domestic violence or dementia, to name just two. Normalising these feelings at the beginning of the session and notifying that students can leave at any time if they feel they need to may reduce anxiety around the subject. All four of these interact with one another to influence the efficacy of your small group teaching session, so having some strategies at hand to address each will prepare you well for your next session. The student-to-student and student-to-facilitator relationship is central to creating an effective group dynamic for which you as a peer teacher are already at an advantage. The common educational background already makes you an authentic teacher, an ally in learning, and it also makes you a credible teacher, one in which the students trust to deliver appropriate and accurate knowledge. However, an awareness of the balance between these two factors will aid you in maintaining an effective small group teaching session. In the medical profession, you will most likely find yourself teaching in small groups in clinical settings. This environment is fantastic for teaching the clinical skills required to work in healthcare, but being mindful of the attributes that make effective teachers in this setting and factors that can negatively impact upon your session will optimise it. Effective clinical teaching is characterised by inspiring, supporting, actively engaging and communicating well with students. You should be cognizant of the impact your teaching has on patients as well. Are they comfortable with having 6 students around their bed for teaching? Think about the influence that your teaching has on staff and your own personal effectiveness in the clinical setting. The benefits of small group teaching are flexibility, interaction, engagement, and the development of higher order thinking. The small group allows you, the teacher, and the group to be flexible in the method in which you achieve the learning outcomes. This self-regulated approach to learning allows students to develop lifelong learning skills applicable to a variety of learning environments. Interaction within the group allows you to pool collective knowledge to the betterment of all. Furthermore, you can also give regular feedback about the student's performance and receive feedback yourself about how effective the teaching session is. Similarly to feedback, it is essential to gauge engagement from individual students through looking for non-verbal feedback, such as contribution to the group, or being distracted from the task. You can modulate your approach to increase engagement through implementing alternate teaching strategies. Small group teaching allows for greater discussion and exploration of the topic, promoting higher order thinking. This can develop skills such as reasoning, problem solving, and interpersonal skills. This is represented in Bloom's taxonomy, where the different levels of cognition are outlined. Perhaps you could think about which level you want to achieve from your teaching session and design activities around this. Finally, have a think about some commonly encountered difficulties with small group teaching sessions. The group may be silent or unresponsive. The discussion may go off topic. Lack of engagement from certain individuals, and there may be overpowering individuals within the group. Small group teaching is a great way to provide personalised education to students, and mindfulness of the outlined influencing factors and having appropriate strategies to mitigate these will aid you in providing the best session possible.